So let's start. Hello, everyone. Welcome to this session on low carbohydrate diets. My name is Sana Ajmal, and um, I'm from Pakistan. I'm a person living with type 1 diabetes and a diabetes advocate. Low carb diets is a very interesting topic and an interesting debate, actually, that goes on worldwide, whether it works or it doesn't work, whether people with diabetes actually like it or they don't like it. So that's the questions that we'll try to explore today. I've got supposed to have three speakers with us, but one of the speakers is probably not shown up. Am I correct? Okay, so we'll have two speakers today here, and some more time for questions and answers later on. The first speaker is going to talk about Mediterranean diets, and her name is Asma Banchora. She's from Spain, and she's a doctoral researcher at a university in Spain, interested in NCDs, including diabetes, cancer, and dementia. So let's give her a round of applause. And give her a round.
Hello, can you hear me well? Okay, hi again. Very happy to be here. My name is Asma bin Shohara. I am originally from Algeria, but I am living in Spain currently. I am a dietitian. I hold a master's degree in nutrition and dietetics, and currently I am doing a PhD research related to the third type of diabetes in Spain, in Castilla-La Mancha. So, today I'll be happy to share my journey in exploring the healing touch of the Mediterranean diet in diabetes care. Okay, how do we move to the second slide?
Green button, a red button, the green goes forward.
Okay, good. So, coming up through covering that journey, I will be doing that in 4 steps. First, I'll tell you a story about someone that I love who has been through diabetes. Second, I will reveal some secrets. I'm Algerian, living in Spain. I experienced the Mediterranean in both sides, so I happen to know some secrets. We'll see how those secrets contribute scientifically into improving the life of diabetes, the people with diabetes, and how can anyone move smoothly into adherence to the Mediterranean diet. So, okay, first, I have no interest to declare in this research. So this was my master's thesis, the research that I'm about to mention. Okay, the picture on the left is my dear person, my father. He is 55, diagnosed with type 2 diabetes, COVID-19 survivor, and last year he experienced an open heart surgery for replacement of the aortic valve, which was calcified. On the right, there is a biochemical test results of my father. The first part of the tests are related to his post-surgery, which is what we have to keep in check, the thrombin rate, the prothrombin rate. And the second section is what matters to us the most today. His glycemic, the results are in French, so I will translate. His fasting glycemia is 0.97, pretty normal and the usual number. And his HbA1c is 5.51, also perfectly normal for a diabetic person. Now, let's not pay very much attention to his triglyceride. It's still work in progress. Now, looking at those test results alone, I highly suspect that anyone would associate my father to diabetes. Now, how did we do that? To note, my father does not take insulin. It only takes pills. Okay? Now, of course, I am a dietitian, I'm not a doctor. I do not ignore the effect of medication. I emphasize the role of nutrition. Okay, raise your hand if these two ingredients is what comes to your mind when you think about the Mediterranean diet? Okay, interesting. Well, I hate to disappoint those who raise their hand, but the Mediterranean diet is way more than olive oil and fresh bread, even though they are quite their champion. So the Mediterranean diet is very colorful and very rich in everything you may ever want to eat one day. And it's not necessarily going to hurt you, okay? Because I think that at a certain point, we started to fear food because at some point, everything we eat hurts us at a certain level, which became very scary. Okay, today I will reveal 3 secrets about the Mediterranean diet. The second is my favorite. First, diversity. Like you've seen in the previous picture, the Mediterranean diet is very diverse. Anything you may ever have in mind, there are plenty of options in the Mediterranean diet where you can have it. So, antioxidants, let's say inflammation. In order to fight that, you have plenty of options. Olive oil, you don't like it? Fine. Red grapes. We also happen to have a list of herbs that can all of it contribute into removing the inflammation from your body. Second, healthy fats. We have, in addition to olive oil, we have fatty fish. You don't like salmon? Okay, nuts, seeds, and many other options. If you want to keep your muscles strong, considering lean protein, chicken, and eggs are quite a good option and very widely used in the Mediterranean diet. If you're a vegan, we have other options for you like beans. So, fibers and minerals. It's good to keep your digestion quite active. Therefore, legumes, whole grains, vegetables, fruits, all of that is plenty. There is plenty of it in the Mediterranean diet. And in order to keep your gut happy, we have fermented food. Yogurt, pickles, wine, you name it. So you have a lot of options to consider here. The second secret, my favorite, la sobremesa. This is a Spanish term which is literally translated into upon the table. So people in the Mediterranean do not consider food just a way to fulfill their body, but it is an entire experience. Food is meant to be enjoyable, appreciated, and also shared with loved ones. And there are many studies that proved that social eating and slow eating have a good impact on insulin spikes. For example, specifically slow eating. People who eat very quickly, usually alone, end up having really high spikes of insulin. However, people who eat slowly, enjoy their meal, they seem to have lower spikes of insulin, which is good. This is what we want. And it's fun. The third secret is the lifestyle. Now, I know we keep saying the Mediterranean diet, which means food, but it's an entire lifestyle, okay? Movement. Everybody in the Mediterranean area moves, especially having walks post-lunch, evening walks, night walks, morning walks, whatever you like it. So people in the Mediterranean area seem to move a lot. And sunlight, sleep, stress management. You would probably rarely meet a very angry and stressed Mediterranean person. They always seem to be quite cool and chilling with life, like everything that may ever happen, we can work that through. Like, it's just life, right? So all of this keeps a person's hormones in regulation, and insulin is a hormone. So, another amazing secrets. Okay, now let's take these secrets and put them into tests. So this was my master's graduation project. So what I did is, the basic idea was to try to cure, heal, reduce the chronic fatigue that everybody seemed to experience after their COVID infection, especially diabetes patients. Many type 2 diabetes patients who suffered or got infected with COVID-19 experienced extreme fatigue post to their infection. The purpose of the study was trying to reduce that extreme fatigue through proper diet, okay? And happily, it seemed to give good results on their diabetes as well. So we recruited around 13 patients. I didn't have much time. It was a master's project, so 13 was quite good. Also, they had to be previously infected with COVID-19. They had to be diagnosed with type 2 diabetes, and they had to be experiencing chronic fatigue because there are a type of people who were not experiencing any fatigue at all. We collected some data, basically their clinical data, their food pattern, what they were eating, and their fatigue level through the fatigue severity scale going from 1 to 10. And then we took them into trial. The trial was the following. We took these people for 90 days. We delivered to them weekly nutritional, education session related to their nutrition. We will teach them what to eat and how to eat it and how to go from their current diet into an improved version of it to control their blood sugar levels and reduce their chronic fatigue. Okay, that's a surprise. This study was done in Algeria. Algeria is a Mediterranean area. However, these people don't seem to be following the Mediterranean diet recommendations fully. So, for example, they are supposed to be taking 21 to 28 serving of vegetables per week. They weren't. So that was surprising for me. So the purpose was, we did not define the instruction until we saw this result. So what we did was, according to this, the purpose was, okay, let's make you reach those recommendations, okay? So if you're not taking enough, start taking. And this is the results that we got. Improvement in basically everything, including their HbA1c, because 3 months is the minimum. So we didn't get really significant results, but it's still positive. Blood levels also seem to be good, lipids, etc. And fatigue levels improved. Now, this is very important. I know I'm overdue, but this is very important. How can any one of you adhere to the Mediterranean diet? One rule. This is your plate. Split it into 3. Half of it, vegetables and fruit of your choice. I'm not going to force you to eat something you do not like. That's not me. The second half should be split into 2. The first quarter, any type of protein that you prefer, fish or vegetables or meat, eggs, dairy, whatever you like. And the third part is carbs. I prefer it to be integral because it will also have fibers, which will keep your intestine very happy. So this is the right way to include. I think it's quite easy to do that because it's not very specific. Like if you don't like something, you don't have to eat it, okay? Because adhering to a diet is a lifetime thing. It's very difficult to make someone eat broccoli for the rest of their life if they don't like broccoli.
Sorry for disturbing, but last minute.
Yes, okay. For the exact steps that were applied into this study, this is an ebook, free. You can have it through, scanning this QR, and you will know exactly what we did in this trial. Yeah, if you want to have a longer conversation, find me on LinkedIn. Thank you.
Thank you so much, Asma. Would you like to come and join me here on the stage? We'll take questions and answers later. So I'll now like to invite Lucía. Lucía is also from Spain, which is an interesting thing about this discussion happening here today. And she's going to talk about therapeutic carbohydrate reduction for type 1 diabetes. So Lucía has been living with type 1 diabetes for 33 years. She's a commissioner for the Lancet Global Health Commission on People-Centered Care for Universal Health Coverage, a DDoc voice, and an associate with an ODI Impact. Welcome, Lucía.
Thank you so much, Sana, and thank you, everyone. I would like to start with a question. Have you ever wondered if the standard diabetes nutritional recommendations for people living with type 1 diabetes are the best for everyone? Before we start, I would like to make a quick check. So please raise your hand if you live with type 1 diabetes. Okay, we have some people living with type 1 diabetes. And from those of you living with type 1 diabetes, how many of you have been offered the option of following a low-carb approach for your nutrition and treatment of your diabetes? Please raise your hand. I don't see any hands. Okay, this is talkative itself, right? Because so many people, including myself, have been living with type 1 diabetes for so many years. In my case, 33 years. It's a long time. But it wasn't until 2017 that I found a book called Diabetes Solution by Dr. Richard Bernstein that I could start having better glucose levels and glucose values. What changed? Many things, because the management became more intensive. I took special attention to my insulin, but it was not only that. The nutritional approach was essential and key, and that has a lot to do with therapeutic carbohydrate reduction. This is myself. Hello, I'm a lawyer. I specialize in patient rights. I live with type 1 diabetes for many years, as I already shared with you. I'm a certified expert patient and a diabetes educator, and also a strong diabetes and NCDs advocate. So when I was invited to become a speaker here at IDF, a great honor, the first thing that came to my mind was, oh my God, what am I going to talk about? Well, I was offered a name for my session, 30 years living with diet. 30 years? What? So that made noise, like, what do you mean 30 years living with diet? Who can live on a diet for 30 years? Generally, we think of a diet and we think of something that is restrictive, that it's you are depriving yourself from having nice food. Well, this is not the case. We live with type 1 diabetes, and people living with type 1 diabetes need to follow a nutritional approach that's sustainable, because you have to keep on eating that way for the rest of your life. You have to manage your food intake forever. So the approach of a diet is not the right one, in my opinion. I think that we all need to find what eating patterns best suit us, our lifestyle, our activity, and our preferences, what we want to do as people, what we want to do professionally, our everyday routinary life. So I was finding out about the general recommendations of the ADA. And I found out, to my surprise, that many in the standards of care, in many of the recommendations of the ADA, for example, an individualized medical nutrition therapy program, is something very similar to what I was doing. Meal plans that keep nutrient quality, total calories, and metabolic goals in mind, because we all have different metabolic goals. An inclusion of non-starchy vegetables, whole fruits, legumes, lean proteins, whole grains, nuts and seeds, Very low dairy, well, that doesn't combine that well with what I'm doing, but it could be maintained. Consider reducing overall carbohydrate intake. Yes, those are the words of the ADA. And that's what I'm following. So maybe we have to rethink the recommendations that are currently being given. The food pyramid that is based on the nutritional recommendations at the moment is that the one that you can see on the right. And in the base, you find grains, starches, bread. Bread, for any person living with type 1 diabetes, is really challenging. I personally wonder why when we go to conferences, diabetes conferences, the narrative sometimes is, just eat what you want and apply insulin. But that does not guarantee a steady management of blood glucose levels. So some of us have decided to make this approach public, and even if it might not be for everyone, we think that it's information that we should have upon diagnosis. It's just another option to take care of your diabetes, and it works. It works. Provide education on the glycemic impact of carbohydrates, fat, and protein tailored to individual needs. That's right, when we do carb counting, it doesn't always work because we have to take protein and fat into account. People following a lower carb approach do really need to be very careful when dosing for protein. But this is something that is not discussed at the everyday practice, and we should bring this discussion to the public, to our doctor. We need to go to our healthcare professionals, and we must be able to obtain the information and the follow-up. And why aren't the nutritional approaches that are generally recommended not working? Because we see data like this. In Spain, there are less than 1/3 of people living with diabetes reaching the ADA target of less than 5% HbA1c. When it comes to the USA, 21% of adults have an HbA1c less than 7, being these results worse in the pediatric population. So, what's the suggestion? The suggestion is therapeutic carbohydrate reduction. There are 3 possibilities. Moderate carbohydrate reduction, that could be from 50 grams of carbohydrates per day up to 130. The main idea here is to reduce especially ultra-processed food that can be so challenging for our blood glucose levels. Then we have a low carbohydrate diet or approach that would be from 30 grams of carbohydrates to 50 grams of carbohydrates a day, or very low carb approach that would be ketogenic diet. In my case, I follow the number 2, low carb, from 30 to 50, but any reduction in carbohydrate, keeping healthy carbohydrates, the vegetables, it's beneficial to our blood glucose levels. What are the pros? Well, reducing insulin requirements. Less carbohydrates, less insulin. Minimizing glucose variability. We all know that the greatest spikes come from high-carb food, rice, bread. These foods are really challenging for us. And another pro is achieving more stable blood glucose levels, but it's not just about the numbers in the meter, it's about how we feel as people living with diabetes, as patients, as persons, as wives, as mothers, as friends. We work better when our health is better. We are more productive, we are happier when we feel better. Less hypoglycemic episodes, More carbohydrates imply the need for more insulin. So in taking less will obviously mean less insulin. What is the only cause of hypoglycemia in a person living with type 1 diabetes? We don't produce insulin ourselves. So, of course, it's the insulin that we inject from the outside. The lower the amounts, the less chances of hypoglycemia. And it also reduces insulin resistance. The Society of Metabolic Health Practitioners has developed with a modified Delphi methodology this consensus position statement on therapeutic carbohydrate reduction, advocating for the inclusion of this nutritional approach for all people living with type 1 diabetes. I invite you to download it. You can scan this QR code, and the download is completely free. And you can find out more. Essentially, it's what I've been sharing with you, that the outcomes for type 1 diabetes are not being good enough, and that we must count with more support from our healthcare professionals, and our healthcare professionals must be informed of this option, at least provide this possibility, this option, then the person can decide. But at the moment, we are not obtaining that support. And all we know, we are learning, finding out because of this book, studies that we read. We need to have institutionalized support for this. And it's not just my story, Lucy. It's the story of so many people. Well, in the case that you see this man, Mark, he lives with type 2 diabetes. Low carb is working great for him too, but the rest of the people that you see are thriving thanks to this method. And I just collected some images, but these are not the only people thriving with this. I'm representing and being the voice of a very, very big community. And more and more companies, foundations, and organizations are starting to support us. So, it's important to first raise awareness on this issue. Let's start having conversation about the nutritional approaches available for people living with diabetes. Let's ensure personalized care. If we decide to follow this approach and it works for us, we need the help and the support of our health professionals, and we need to be understood because there's no one-size-fits-all in diabetes. Increase research efforts. We need more studies and more advocacy to be fully aware that it's something that not only works, but it's also safe. We have living proof of this, but this has to go to the papers. And let's train clinicians to provide support and provide this option that is so valid for so many. I would like to finish by thanking the IDF for giving me the opportunity to talk about this essential topic for the diabetes community, for the type 1 community. And I would also like to thank Dr. Bernstein, who is 90 years old this year. He lives with type 1 diabetes himself, and he discovered this method that changed his life and allowed him to live a long and healthy life. Thank you so much.
Lucía, can you join me here on the stage? Well, I thank both the speakers for their very insightful talks. I do feel like that sometimes people with diabetes need to have informed choices to make. Not everyone might like to live with, to have a low-carb diet, but yes, the informed choice is the right way to go. But I would like to invite all of you to ask our speakers any questions. By the way, the pictures were mouth-watering. Any questions from the audience? Okay, I have a question online which says, would low-carb Mediterranean diet be the best option? Any of you can take.
Okay, so this is a very vast question. Can you hear me? Yeah, I think you can. Like Lucia said, there is no one type of diet that will fit everyone. But the good thing about the Mediterranean diet is, like I showed you earlier, that it doesn't narrow your options, but it gives you more options. So the idea is that for me, I would definitely sell a Mediterranean diet to anyone I meet. But again, it is related to your preferences, your current situation. How are your blood sugars currently doing? Are you stable? Are you in a very dangerous spot? So it's quite relevant, but I would say that the Mediterranean diet can be a quite good option to you, to diabetes people.
And I would like to add that as a Spanish person, of course, I'm going to defend the Mediterranean diet. It's amazing, and olive oil is just the best.
Well, anyone who has a question can come to the mic and ask.
My name is Corina Pelin from Romania. I'm a registered dietitian, and I would like to ask for type 2 diabetics if we would recommend a low-carb diet. Would be treating the symptom or the cause, since we know that in type 2 diabetics, insulin resistance is the cause, and carbohydrate raises the glucose only as a symptom, not the cause. The cause we know that is lipotoxicity from saturated fats. So what would you recommend in type 2 diabetes?
When it comes to type 2 diabetes, the low carb option is already an option that is officially recommended in the guidelines. And it's a valid option that is contained by the American Diabetes Association. I'm advocating for the same inclusion for type 1 diabetes, as there is more reluctancy to accept this approach for type 1 diabetes, mainly due to fear of hypoglycemia. But as I said before, hypoglycemia only occurs when there is an excess of insulin in the body. In the case of type 1 diabetes, all insulin injected is injected from the outside. So the less insulin injected, the less chances and the less the odds to develop hypoglycemia. But yes, for type 2 diabetes, it's not just a recommendation, but also it's actively encouraged.
Yeah, I wonder if we don't worsen the insulin resistance if we go low on carb. If we are going with animal fats, that would...
I'm not defending the high-fat diet. In fact, there are many nutritional approaches. Mm-hmm. The one that I follow personally increases the consumption of protein and follows a low-carb approach, but not removing carbs. I mean, there are many carbs that are very healthy and are contained in vegetables, and the idea is not to go keto or excess fats, at least from my own perspective. Mm-hmm. Any reduction in the total carbohydrate amount that we are intaking is going to benefit our glucose management.
I have a type 2 diabetes remission program, and we use more than 60% carbohydrates, of course, complex carbohydrates, and we have a very good remission rate. They lose weight and they feel full because of the fiber, and they improve their insulin sensitivity very much.
Well, it's good, but as you know, type 1 and diabetes and type 2 diabetes are very different conditions.
Ask Asma if she wants to.
Only about type 2 I was
in fact, there is something I would like to add. Now, something I didn't have the time to mention during my presentation, which is the order of food.
Yes.
When you eat your carbs first, and then you move to protein and then fibers, when you go and test your blood sugar, it's going to be higher than if you start with the fibers, aka vegetables, and then move to protein and carbs. So the order of food is very important. And if we're going to talk about it biologically speaking, you know how fiber will like create a wall in your stomach. Let's imagine it this way. Fibers will create like a small wall in your stomach or intestine that will reduce the absorption of sugar. Therefore, lower spikes. Happy you.
Thank you.
All right, thank you. Yep, do you have another question?
Assalamu alaikum. I'm Dr. Mohammad Naeem Afsal from Pakistan. I just want to have your comments on a campaign on social media that there is high amylopectin, branched chain amylopectin in the wheat. That's why it's causing high spikes in sugar, and other cereals that have complexed or they're long chain amylopectins like barley or like that, they have lesser spikes in sugar. So do you think wheat is causing trouble with us?
And can you rephrase the question, Sana, for me, please?
So there's this element, amylopectin, which the doctor is mentioning, and you're saying that that causes the spikes in
Yeah,
blood
especially
sugar.
in wheat.
They're contained in wheat, and they cause the spikes in blood sugar. Is that something that you agree with?
Yes, of course. With spikes blood sugar levels, and it's challenging for managing as a person living with type 1 diabetes. I mean,
Refined wheat. Refined wheat is definitely, yeah. But whole wheat, no.
Well, I have seen a lot of improvement in my patients. If I replace even wheat with husk, I replace them with barley, and the diabetics as well as obese patient, they improve a lot.
Well, looking at that wheat like as separate ingredients, you will see that wheat and barley have different amounts of fiber and different amounts of, I would say, starch. So therefore, automatically the result is going to be different. Even if you're like not thinking about it in a taste matter. When you eat something with wheat, refined wheat, it's quite more easy to eat, more easy to I don't want to say enjoy.
Yeah.
But when you eat it integral or whole, it's not the same. But you will notice that when you eat whole grains, whatever types, I would say any type of cereal whole, you will feel full for a longer period of time.
okay, from my patient perspective, a person living with the condition for so many years, whole wheat or not whole wheat has a very, very challenging impact on my glucose levels. So that's why I take the personal decision of avoiding it, and that helps me manage my blood glucose levels better. Reason why I ask for more research and support from my healthcare professionals, because I want to go to my healthcare professional and listen to his or her advice, to have his support, telling me, don't worry, we will follow you up. We will see how you're doing, how your test works, labs are going. And I hear you. I hear you that this is not working for you. So maybe some people need to hear that if it's whole, it's good, and keep on trying. But if we have tried and then we tried again and then we tried again and it never works, it's definitely something that must be acknowledged, that we must have an alternative.
I think we need a lot of research on substituting barley with rice. That may change our perspective.
Thank you so much.
Thank you.
I also think that we need to have a communication guideline about how to communicate about diets to your patients, because that's very important. Sometimes it puts people off, because when right after diagnosis they're being told to go low carb, there's a lot of trauma. So yes, some communication guideline also needs to be developed. There are 3 questions online, and I'm going to ask them. For the carb content for the LCD for type 1, what is the carb gram amount for each meal? That's, I think, for you, Lucía.
So what was the question again?
For the carb content for the LCD for type 1, what is the carb?
LC, therapeutic carbohydrate reduction.
What is the carb gram amount for each meal? How many grams of carbs per meal do you?
Well, that's very personal and subjective. because not everybody intakes the same amounts of carbohydrates every day. We generally follow our routine, but it depends if we are traveling, if we have an event. But, well, the three therapeutic carbohydrate reduction models that are reflected in the paper that I previously shared with you are moderate carbohydrate reduction that could be from 130 grams to 50, low carb from 50 to 30, and less that would be ketogenic diet.
So you still adjust your insulin dose as per the carbs, but you try to keep it low carb? That's what you're saying?
Yes, of course. And also I apply insulin for the protein because we all know, and the American Diabetes Association also acknowledges that also fat and protein modify our blood glucose levels, and we have to learn about that. And it's not easy. But when you follow a high carb diet, it's very important to count the carbs because most of your blood glucose variability is going to come from carb intake.
We have a question there.
As doctor said, even in India, we are facing that wheat is causing more spikes than rice. And again, barley is much, much better, as he said. And again, if you recollect, when I read medicine in 1982, there is a word, wheat is strongly diabetogenic. Even we are observing that what you said, wheat is not that good like rice or barley. Barley is much, much better.
Well, thank you for this comment. So there's another question online, an interesting one, which is, do you think that the price of Mediterranean diet might decrease the adherence to it?
Okay, that's a tough one. Well, one of the challenges that I was experiencing with my 13 patient was that the reason why they were not following the diet 100%, like when in the first baseline was a test that we did, was because they couldn't do it. Economically, that was not possible. So I went 5 steps forward and I prepared affordable recipes for desserts for them. And I shared them. This is what happened. I tried to think in their to be in their shoes, put myself in their shoes, and create recipes that they can afford. So again, it's a very personalized process, an approach that everyone will take it as much as they can. So having enough knowledge about what every ingredient does to your body and every category of food does to your body, and then you can choose from which you can eat and how much. So that's why, again, I see that the diet that we chose to work with is quite flexible. It can work for people who cannot afford specific food, and it can work with people who can afford anything they want. So I think we have a quite vast place to play on.
I would like to say and acknowledge that when it comes to follow a low-carb diet, Mediterranean diet, a great challenge for so many people is to avoid the carbs because the cheapest things are bread, are ultra-processed foods. So there's something really unsustainable about the food industry that it is cheaper to eat unhealthy. And that's not causing the best outcomes in our health. If we want to have high quality protein, that's expensive. And it's okay maybe if we are speaking about my country, Spain, but in low middle income countries, that can be a real challenge. And we must acknowledge this.
It is a real challenge. In Pakistan, we take our energy from putting 3 teaspoons to 4 teaspoons of sugar in a cup of tea. So, yeah.
Yeah.
Okay. Has anyone else got any questions? No? So okay, so I'll ask you to join me in giving a big round of applause to our speakers. And thank you so much for attending.